Welcome everyone. I know there's people still joining. We're going to give everyone just a few minutes, another couple of minutes, and then we'll get started. So it's fantastic to see so many people joining from all over the world. It's absolutely wonderful. Okay, I'm going to do a preliminary introduction and we'll get ourselves going because time is a little tight and we have some fantastic things to hear and we want to keep plenty of opportunity for discussion. My name is Emma Stokes. I'm the president of World Physiotherapy and I have a fantastic day job. I'm the head of the Department of Physiotherapy and Rehabilitation Science at Qatar University. So I'm coming to you live from Doha. And these webinars actually arose out of a number of conversations over the last few months when we established a global task force, an education task force, on looking at the impact of COVID-19 on physiotherapist entry-level education. And we really got to recognizing that there was a need for us to start sharing some of the experiences. And so I'm absolutely thrilled to introduce this very first webinar, one of a series on teaching with restrictions during this extraordinary time that we're living in. And I am going to hand over to my co-moderator, Professor Suh-Fang Jeng from Taiwan, who will take us through the next steps of the webinar. So welcome everyone. We're thrilled that so many people are here from all over the world.
Thank you, Emma. Hi everyone. I'm Suh-Fang Jeng, Chair of the Asia Western Pacific region and a faculty of National Taiwan University. It is my honor to join Emma and the panel to welcome all physios around the world to the first webinar in a series about the impact of COVID-19 pandemic on our entry-level education. Human history tells us that 100 years ago, Spanish flu was a devastating event that has lasted for 2 years and caused over 20 million mortalities. The implications from that event were that wearing masks and social distancing are very important to contain the infection. And the WHO was established later for international collaboration. The COVID-19 pandemic is the first event in the physiotherapy history to impact so many education programs in the world. In response to this crisis, physio educators are fortunate to have modern digital technology to offer online education to our students. And the WCPT has taken proactive actions to set up task force, information hub, and an FB group on education for sharing resources and information. And the impact of COVID-19 pandemic has varied from country to country. Taiwan is lucky to have about 500 cases today, and we implement strict measures of personal hygiene, social distancing, and contact tracing to contain community transmission. That all our clinical practice and schools have remained open, with 20% of courses online and 80% in person. Today, we are very happy to invite 3 distinguished speakers: Dr. Roy Film from the United States, Dr. Ryland Olsen from Norway, and Dr. Oscar Ronzio from Argentina to share with us their education experiences. Before we get started, I would like to ask all attendees to fill out 2 questions in the poll about your original base and teaching format. Thank you. We would like to encourage you to raise questions or make comments at any time during the webinar using the Q&A feature. Okay, now that's the time for me to introduce our speakers for today. The first speaker is Dr. Oscar Ronzio from University Moderators, Argentina. The platform is yours.
Thank you very much. It's an honor for me to be here with these honored persons and to present this experience in South America, especially in Argentina, about our COVID pandemic. I'm Oscar Ronzio, and this is my recording of my conference. Hi, everyone. My name is Oscar Ronzio. I'm the chair of World Physiotherapy South America region. Everything is fine. Can you hear the sound now?
Excellent, yes.
Perfect. I'd like to thank to the Educational Task Force for inviting me to this webinar. As you know, World Physiotherapy is divided in 5 regions. South America includes Argentina, Bolivia, Colombia, Costa Rica, Peru, Uruguay, Brazil, Chile, Ecuador, Mexico, y Venezuela. The minimum qualification required to practice is bachelor degree in all the countries. In this map, available at World Physiotherapy, you can observe how many entry-level education programs per 5 million people exists in the countries. As you can observe, Brazil has the bigger number. Brazil is also the only one country in our region in which online PT programs are allowed according to local regulations and were running before the lockout. We didn't saw with good eyes having PT programs that are 100% online, but these universities were much better prepared for the e-learning than the traditional ones, which had to migrate in a couple of weeks to this modality. At this moment, we have many modalities running in the countries. E-learning is being slowly replaced by blended learning. Mexico has a traffic light system. Classroom teaching will be a law only when the jurisdiction is in green. And now I'm going to give you my experience in Argentina. I work in 2 universities with different realities. Universidad Nacional Arturo Jauretche has 4,100 PT students with a mean age of 26 years old and is placed in one of the lower income districts called Florencio Varela. It is a free university with no limits in vacancies. The university also includes a hospital, a health institute, and a university. This building was created in 1940 as a research institute of petroleum, and then renewed as a university. We receive more than 10,000 students every year, and 55% of them are for health careers. The virtual campus uses Moodle. The architecture, hardware and software was not prepared for this amount of students, so to reduce the traffic, most of the professors only use it for linking pre-recorded classes that are uploaded to personal YouTube, Vimeo or Google Drive accounts. According to local regulation, it is very important to register every activity in the campus, as you can see in the present video. The lack of digital books in many disciplines was a big problem, and our students do not have money to pay for them. Many of our students also have limited access to internet, so the university gave them a SIM card with 3 GB. According with an agreement between the government and local companies, the access to the campus do not consume any data. Simultaneous online classes are also conducted by Zoom, Meets and other platforms. Participation is not mandatory, and we record and upload them to guarantee access to everyone. The clinical practice now has been replaced by telehealth. In this photo, you can see our students following suspect cases by phone. On the other hand, we have a very different reality. Universidad Maimonides has 120 PT students, and it's placed in Buenos Aires City, and it's a private university. I'm the head of the PT department here, but despite of that, it's a good example for other private universities. In this case, we did not have any architecture problems with the campus. Some programs, like nursing, are using Moodle, postgraduate courses are using Blackboard, and we are using a tailor-fit campus based on Microsoft. Because of that, the students also have the access for free to Office 365. As it is based on Microsoft, I can use the Power BI to audit many different variables of teachers and students. Having data is always desirable. In July, the government launched 3 protocols, one for schools, one for institutes, and one for universities. You can download the last one using the QR code. According to that, we started working in the return to the classroom. Universities are now open just for a few procedures, with a protocol that includes foot mats with disinfectants, temperature measurement, alcohol-based hand sanitizers, identification and safe distancing. Chin straps are also mandatory. Based on this document, our team developed a plan. This includes the use of our 3 entrances, one for the staff, one for the students, and another one for the patients. Many thanks to our architect, Elizabeth, for the plans. In case of positive triage, we have a room for isolation so the patient can wait to the sanitary authorities. This is the distribution of a big and a small classroom, according to the regulations. The problem is that the social distancing is not compatible with practicing PT skills. That's why the best option are bubble rooms. This will allow us to isolate just a few students in case of a positive case. The use of air conditioner or not is still unclear for us. Special filters should be installed. In the meantime, ventilated spaces are recommended. In green, you can see the air circulation direction in the planes. Of course, windows must be open. According to normatives, the density is 1 student per 2.25 square meters. Maximum capacity, so it's 36 students per floor. In this case, the limit is established by the whole area, which is our common space. Last Monday we received the recommendation to facilitate the accomplishment of the program for students that are near to graduate in health sciences. The problem is that we have this other recommendation suspending clinical practice since March 2020. Fortunately, we have been working in many things. In June, we established the telerehabilitation service in our clinic. Students are doing the attention under professional supervision for free to the community. This activity is exclusive for the final year students to accumulate clinical practice hours. You can see here our promotional flyer and the informed consent. Many final theses are also related to this topic. We are also upgrading our simulation center with full functional intensive care unit rooms, mannequins and equipment. We are also preparing the rooms and the operating rooms for other programs. Software-based simulators were not so useful for us, but we are still looking for options. High-end simulators probably will be considered as training hours. Thank you very much. I hope you find this information useful. If you have any questions, I will be available after the presentations. Thank you very much again. Now on live.
Thank you.
Thanks, Oscar.
Thank you. Thank you, Oscar, for your covering of South American education status and hard work in planning for return. And our next speaker is Dr. Nina Osen from Western Norway University of Applied Sciences. To to share with us her education experiences. Please go ahead.
Thank you very much, Suh-Fang. It's an honor for me to be here as well. And hi, everyone. I'm Nina Ryland Olsen from the Western Norway University of Applied Sciences. And I'm happy to present also my presentation that is pre-recorded. I will just share with you my presentation.
Oh, my name is Nina Ryland Olsen, and I am an Associate Professor and Head of Evidence-Based Practice Section at Western Norway University of Applied Sciences. I will now present a case related to teaching spaces with restrictions, seen from a Norwegian perspective. I will share with you consequences of this situation on our teaching and curricula, and then go on to explore how we have met the challenges concerning safety in our teaching spaces. Lastly, and perhaps most importantly, I will focus on implications for students. Before this, just to give you some background information about our institution. Western Norway University of Applied Sciences is one of the largest institutions of higher education in Norway, with around 16,000 students and 2,000 employees. We graduate nearly 5,000 candidates each year. We have 5 campuses that stretch along the western coast of Norway and are organized with 4 faculties within the fields of business administration and social sciences, education, arts and sports, engineering and science, health and social sciences. We have a professional and working life-oriented profile with a broad range of academic programs at bachelor's, master's and PhD levels. We offer 2 physiotherapy programs, Bachelor in Physiotherapy and a Clinical Master in Physiotherapy. Enrollment in our master program require a bachelor degree in physiotherapy, followed by 1-year mandatory practice or internship, which is also what is required to be certified as a physiotherapist in Norway. In Norway, physiotherapy is protected by law, both title and functions are legally defined. March 12 this spring, we closed all campus activity with immediate effect. In August, we're almost back to normal, but several restrictions were implemented. For example, teaching spaces or room capacity was reduced by 50%, meaning that we had to move more than half of our teaching online. The transition from face-to-face to online came as a surprise on many, and I am questioning if we were prepared. The learning curve has been steep, and likely this has had an impact on the quality of teaching. Some of the faculty were used to using digital technology in teaching, but for others, this was a complete new thing. And despite not being ready for this transition, changes had to be made to our curricula. We had to change several exams for spring 2020 to avoid students being delayed. Exams could then take place when planned only online. Practical exams were changed to online oral exams based on cases. Third-year students made their own case based on real patients from clinical placements before COVID-19. This semester, we are allowed to arrange practical exams at campus. All other exams must be digital or online. Faculty report of positive experiences with changes to the assessment forms. Although it was difficult to assess skills, they found the exams meaningful and they achieved a good dialogue with students. It also felt reasonable to change the assessment form, as in particular first-year students had not had the opportunity to practice skills before exams, and as such it would have been difficult and perhaps not fair to assess skills as planned. Knowing that our students would have 1-year internship after graduating did help us make this decision for our graduates. Intermediate regulations from the Norwegian government made it possible to make changes to the curricula. The purpose of the regulations are to ensure that students can complete the course and education without major delays. All changes made must still meet the professional requirements of the education. So now about restrictions. Physical distance restrictions at our school are in line with advice to every Norwegian citizen. Everyone should follow good cough etiquette and good hand hygiene. Only your closest circle can be together as normal. Keep a distance of at least 1 meter from everyone but your closest circle. Stay at home if you have respiratory tract symptoms and do not come to campus. Be tested if you have symptoms of COVID-19, and students must inform faculty if such symptoms occur. We also have to follow specific advice for teaching in clinical skills laboratories, which involves restricting the number of persons in any of the labs, not allowing anyone in the labs if symptoms, and contacting faculty immediately if symptoms occur. Requiring students to stay with their cohort for the whole semester, documenting names of students, not moving back and forwards between more than 2 cohorts during classes, changing clothes before and after class, cleaning all equipment between classes. To ensure that no one comes to the labs with symptoms, everyone are screened before each class. Screening questions are as follows. Have you been diagnosed with COVID-19 or are you waiting for test results? Have you been in close contact with a person infected by COVID-19 last 10 days? Have you been traveling abroad last 10 days? Have you had any of the following symptoms last 10 days? So far, we have not been required to use personal protection equipment, although some students and faculty have been concerned about not using masks. Just to illustrate how we have organized our clinical skills laboratories, there are about 2 cohorts per each row with plinths. Neither faculty or student cohorts are allowed to cross the red line in the room, and teachers can only move between 2 cohorts for each session. Keeping distance in between our cohorts in our clinical skill laboratories is possible as we are privileged to have the technology to support us. The spread of COVID-19 is still relatively low in Norway, with about 12,000 cases confirmed. There was an increase in the number of reported cases last week, 751 cases, and 248 cases were reported from Western Norway, where our physiotherapy programs are based. Due to this flare-up, we have moved all campus teaching online for about 2 weeks, except for practical classes in labs. Personal protection equipment is now required for labs, which means that everyone must wear masks. Next, some photos to illustrate teaching in labs. To understand further what our students worry about during COVID-19, I talked to student representatives at both our bachelor and master program. It seems that they all worry about things like, what if we are infected and spread the virus? What if we are exposed to COVID-19? Do we keep sufficient distance? Can we trust fellow students to follow restrictions? What if we catch the flu and miss classes? What if school closes? How can we practice skills when we're not allowed at school except for scheduled classes? How can we interact with teachers as there is no chance to talk to them between classes or in the corridor? How can we socialize with students without risking not keeping to restrictions? I also asked students how they experience the virtual learning environment. Some students seem to be easily distracted and exhausted after longer sessions at Zoom. They prefer not having video on, perhaps hiding, or very conscious that others can see their face all the time, as opposed to in a classroom, when it is mainly the teacher who sees them, and students are generally afraid to ask questions. One student had found a strategy to cope. This student saw the importance of getting ready in the morning as usual, wearing clothes that you would when going to classes at campus, putting away your phone to avoid distractions during lecture. I believe that talking to students and taking care of them and understanding how the pandemic has impacted on students' life is important. Students I talked to reported of being less social, and some students were lonely. They find their friendships are more difficult to establish. This goes in particular for first-year students. Students connect more often via social media, and they are generally more stressed.
Great, thank you so much, Nina.
Thank you, Lina, for your fantastic presentation. And we can see that you have timely responses to pandemic status and sensitive to students' physical and mental health status. Now we're going to move on to the final case study by Dr. Royce Film from University of Maryland, United States of America. Please go ahead.
Hi, everyone. I'm really honored to be speaking with everyone today to share our experiences in what is clearly a very difficult country right now as far as the COVID-19 pandemic, where we've had over 6,800,000 recorded cases so far. So we'll take a look at our experiences here.
Greetings, everyone. My name is Roy Film, and I'm an assistant professor in the Doctor of Physical Therapy program.
Hang on a second. It sounds like I'm getting double sound there. I'm going to mute my microphone.
We have a prestigious graduate-level institution that includes 6 nationally ranked professional schools. Our physical therapy program is housed within our School of Medicine. Our building is marked with the red star in downtown Baltimore, not too far from the inner harbor of the Chesapeake Bay that opens up into the Atlantic Ocean. We're about 1 hour from Washington, D.C. We have a university medical center that's right next door to our dental school, the oldest dental school in the world, founded in 1840, as well as Davidge Hall, which is the domed building to the right in this photo. Davidge Hall, where we hold some classes and special events, was opened in 1812 and is the oldest medical school building in continuous use in North America. As attendees from around the world have likely heard, COVID mitigation, management, and recovery plans have not been going well in the U.S., and our official count of COVID-related deaths already stands at 200,000. In May of 2020, the University of Maryland, Baltimore created our own 2-year recovery framework, building upon guidance from the U.S. Centers for Disease Control and Prevention, as well as from the Governor of Maryland. This COVID response plan went into detail beyond the available guidance, though, creating instructions for return to teaching and return to campus research activities, where we have been awarded over $500 million of annual grant funding for the past several years. Today, some of this research is related to COVID-19 mitigation and vaccine development. This response plan included teleworking for as many employees as possible, at least until the end of 2020, extensive physical safety precautions, moving all educational content online if it could be moved online, rescheduling content that could not be moved online, and approving specific plans for the safe return to those remaining activities that must occur in person. Due to accreditation standards, our physical therapy program was unable to consider certain options. We could not deliver all of our educational content remotely, and we could not record all of our content to post online. Several months ago, as I was trying to figure out how to modify my manual therapy and neurodynamics labs, I joined the World Physiotherapy Network for Physiotherapist Educators Facebook group. I was hoping to find some ideas to help me figure out how to proceed with planning so we could finish out the semester and get our students off to their internships by the beginning of July. I picked up some useful ideas, but the most useful related to what not to do. This included not having students submit videos for performance-based assessments or to obtain feedback on their psychomotor skills. I quickly realized that this was wise advice due to the inability to have a synchronous discussion with the students. This approach would be horribly inefficient at best. Our initial departmental strategy was for each course leader to apply departmental guidelines to create a specific day-to-day plan for their courses. Luckily, we had already been regularly using a wide variety of content delivery styles prior to the pandemic. Much of our content could be modified to a synchronous online format, but we also hold debates regarding areas of clinical practice that have limited evidence, and this was moved online with great success, even though it lost some of its excitement. Even movement assessment labs could be conducted remotely by showing videos that were recorded using a coaching app. While I've used these many times for some of our movement assessment labs in the past, they transitioned fairly easily to an online format if used with the screen sharing feature of most video conference platforms. Most of our adjuncts require significant assistance with technology, however, so we make sure that someone is available to help them during labs. In general, we tried to minimize disruption to our usual schedule if it was safe to do so. To reduce the potential spread of an infection that an asymptomatic student may have, we made sure our cohorts did not come into contact with each other. We scheduled classes so that only one cohort was in the building on any given day. In March of 2020, we moved all lecture content early so that we could continue progressing the students so that they could successfully graduate without delay while we watched the pandemic evolve. One of our cohorts was in the clinic on their internships at the time, and they were all over the United States. So we only needed to run remote synchronous lectures for the other two cohorts at this time. Our class of 2020 graduated on time in a manner similar to so many around the world. It was a surprisingly touching ceremony, and all faculty recorded farewell messages for them. Most of us keep our gowns in our offices, so we dressed up in honor of their unforgettable day. However, they're in the working world now, and almost all have begun to work as doctors of physical therapy and are receiving paychecks. So it was successful. In fact, several of them are working with COVID patients in hospitals around the US this morning. At the end of May, we started our next cohort as scheduled, but fully remotely. Some students remained in their home countries while taking a 9-week-long software-based anatomy class. This is the first time we had ever utilized this approach, as we usually run anatomy with cadaveric dissection and prosections. Content delivery was effective and student performance was good by all counts. When we brought our students back to campus on June 8, 2020 to make up 2 weeks of in-person labs and performance-based assessments, they were the only cohort in the building at that time. Once they went out on their first full-time internship in July, things became easier to coordinate, as they would not be expected to return to campus until graduation day in May 2021. The second-year students then returned to campus to make up in-person labs. Throughout this time, the first-year students remained off campus taking anatomy. Our campus and departmental plans included guidance for cleaning, minimizing population density, and a robust contact tracing mechanism. To prevent crowding at the entrance of the building, we had scheduled arrival times and staggered lab dismissal when we first returned to campus in June. A faculty or staff member asked screening questions before a student was permitted to enter the building. If students passed, then they went through the temperature screening with a different faculty or staff member. Because we sometimes couldn't recognize the students with their faces covered, the students announced their names into a laptop computer where a remote staff member recorded their temperature in the spreadsheet. This is now all being conducted using an online self-report system, and we no longer stagger arrival times. Once inside the building, students were restricted as to which stairwell they could use, with some being up-only stairwells and others being down-only stairwells. We provide face coverings to students if they do not own one. Our campus policy for the classroom setting does not require the use of N95 masks and only requires face coverings. We provide non-latex gloves for the students, and they use hand sanitizer on their gloves frequently throughout each lab. If gloves break, they change gloves, so most students would go through up to about 5 pairs in a day. We ordered more gloves to make sure that we had enough to have 3 for each student. We had been doing our own laundry on site, but the amount of laundry we were generating now made it worthwhile for us to have laundry service pick up and drop off our laundry each day. In order to create social bubbles within our social bubble, all students were assigned to specific lab rooms that do not change. We maintained a maximum of 10 people per room and utilized a 9-to-1 ratio of students to faculty. Students and faculty do not rotate between stations. We used trios of students so that each group would have one student acting in the role of the therapist, one in the role of the patient, and one in the role of an observer to provide feedback for the other 2. We're very fortunate in that our floor plan facilitates our ability to maintain separate spaces. We don't have any particularly large room, but we have some moderate-sized rooms and several smaller rooms. Our layout actually helps us maintain social distance and to perform contact tracing. This is our main lecture hall and 3 of our smiling students. Hopefully you can tell they're smiling behind those masks. We link all of our lab spaces together via Microsoft Teams, and it allows us to show all of our rooms simultaneously. Students who need to isolate may still join labs remotely. All labs are recorded so the students can refer to the recording as they study. The presenter's video can be pinned in each of the rooms. Unfortunately, no video conference platform permits you to pin your own video, so students in the room where you are presenting either have to watch you directly or view the relatively small box on the screen, which is very likely going to be preferable because you can't have them all gather around you. For years, we have used a variety of cameras, including stationary ceiling-mounted cameras and Microsoft Kinect cameras attached above our 60-inch touchscreen Mondo boards. These have limited utility for most orthopedic labs because hand placement and a variety of angles are essential in gaining a good understanding of most physical examination manipulation techniques in orthopedics. Years ago, we utilized iPhones or iPads as mobile cameras, but there was a 1.5-second lag time that made it very awkward to teach in real time. Today, these lag times have improved dramatically. We now join the video conference from a handheld device so that we can get different angles much more easily. One of the few drawbacks is that we cannot zoom in or out, so the student who is managing the camera must step closer or farther away in order to frame the subject adequately. I've also applied these strategies to our residency program, and although it's only 2 residents, all the same considerations apply that would apply to our entry-level DPT cohort of 65 students. One of the things I found useful is the closed captioning feature in Microsoft PowerPoint, which is finally fast enough to be useful in real time. This feature comes in very handy when audio quality is poor, so whether you're lecturing synchronously or asynchronously, this is available for the viewer. I've also found that it helps me speak more clearly since I can see how the software has difficulty in interpreting what I'm trying to say. Unfortunately, we have some experience from teaching remotely through campus closures due to weather and periods of rioting. You can see in the timeline here we closed down on March 13th, and today we are at day 192 of our campus COVID management timeline. And whether it's May 2021 or May 2022 or who knows when, our ultimate goal is to be able to safely graduate new health professionals and return to the types of experiences that we were always able to offer our students. I'd like to highlight the efforts and ingenuity of our staff and leadership team who have helped create and implement a plan that has thus far kept all of our students and their families safe while our students continue to progress safely toward graduation. Thanks for listening. I hope some of this has been helpful for you, and I look forward to answering some questions in the Q&A session. It's pretty important that we all really communicate throughout the world and take some of the ideas that folks have come up with. So I'd strongly recommend that you join the Facebook group and participate in the global discussions related to how to deliver physical therapy education in a safe and responsible manner.
Great. Thank you, Roy, for your great presentation, and your learning activities are very creative. And congratulations to your graduates in the summer. Now I'd like to pass the time to Emma for the Q&A section.
Great, thanks Suh-Fang. Thanks everyone for some fantastic presentations. Just to give you, we've got a really global audience, which is absolutely fantastic. We have physiotherapists from all of the world physiotherapy regions participating, and we've been circling around the 90 participants, which is absolutely fabulous. Mindful of the fact that some time zones, obviously this is not the perfect time. So, you know, with anything that we do in world physiotherapy, trying to capture the biggest part of the world across and up and down often means that we do exclude people on the extremes, but we will be recording these so they are available to our colleagues who might be in bed at this point. Interestingly, from the poll that you responded to, 40 she struggles with her seeing the small data. 45% of you are teaching mainly online. 41% are teaching with a combination of online and campus. And the lucky 14% of you are mainly on campus, which is fantastic. Because certainly what I've learned in the last 6 weeks is that that it's very hard to replace that interaction with the students. Now, we have an opportunity for questions and answers. And indeed, if anyone wanted to make a comment and was all set up with their microphone, if you raise your hand, we'll be able to unmute you and get a comment. But in the meantime, please do pop your questions into the chat. Anything at all that you want to ask, we'd be happy to ask the panelists to respond to. I certainly, while we're waiting for you to get your questions in, the Facebook group, the WCPT Educators Network on Facebook is absolutely, it has saved me on so many occasions, including Roy with his amazing photographs when I was asking questions about PPE and how much to order. So thanks everyone for being so supportive. So we have a first question, which is, and I think Roy answered it, but let's pop it in and see what people have to say, which is, has anyone actually had to deal with the first case of COVID-19 in a student or in a faculty member in the PT department and in the PT program? So, so far so good, I think, with you, Roy, but what about Nina or Oscar, or indeed anyone in the audience who's had to deal with that? Raise your hand if you want to share your questions. So, actually, Stephen, there you go. Stephen's also asked that question, Stephen from Malta. So over to the panelists. Nina, do you want to jump in first of all?
Yes, thank you, Emma. We've been lucky. We have had no cases of COVID-19 at all, not among students and not among faculty. So we have no experience with that as yet.
So far, so good.
Yes.
Excellent. Oscar?
Yes, we have one professor, one teacher that works in intensive care units with COVID, but at this moment we are teaching just online, so there is no problem with that.
No problem. Okay, great. So far, so good. Anyone who's Nina, yes.
Just jumping in to say that what I said in the presentation is that we've had, after we started the semester, and I don't know if I can blame the students for partying, but you know, there was much more contact between students and students coming from all over Norway. So that's when we had a flare-up of cases in Bergen and the area around where we have the school. So we closed down everything for at least 2 weeks.
2 weeks, everything went down. Great,
yeah.
Thank you. Anyone sorry, Oscar?
Oh, this is Roy.
Roy, sorry, go for it, yeah.
We haven't had any cases within our class, but we've had several students who have family members who were positive. So the students had to isolate. So we kept them from coming in for 14 days, made sure that in their trio, that those students were also isolated until they had negative tests. And that's actually happened at least 4 times since March, out of a cohort of 65 right now. But things have been safe within our walls so far.
Great, thank you, super. Anyone in the audience want to make a comment about that, or raise a question about, you know, share us their experiences in relation to that, please do. In the meantime, I do have a question, which is with respect to Oscar's presentation. Oscar, your presentation contrasted 2 very different school systems. Do you think that those students will be equally prepared for practice? Are there any concerns about them practicing the license exams? So that's a question from the US. And so for those of you who are listening in the United States, all physiotherapists take the National Physical Therapy Examination, the licensure examination. So Roy, I'll ask you to answer that one.
Yes, thank you. That's a very good question. We are going to do our best to prepare the low-income universities students for the practice, and they are not going to be prepare to work before that. So yes, all are going to be prepared for our clinical practice with a good condition.
That's super. Thank you, Oscar. Roy, have you had any students take the NPTE yet?
So they tend to take it around April is one of the times that they're given in the US, and then others are taking in July. So our students throughout the United States, the way that the vast majority of programs deliver their curriculum is to front load it, and then the entire last year of their curriculum, they're on their internships around the country. So they've received all their didactic content. So that didn't actually affect this cohort around the country who took the exam this year. So we haven't noticed anything yet. I'm not sure if I would suspect any likelihood that this next cohort might have trouble either, just because they've had trouble learning some of the manual skills, but the NPTE is a computer-based examination. So I suspect that they probably sat home studying quite a bit, although judging by their suntans, some of them were outside quite a bit too. But I think they might actually be, just as well prepared. We won't know for a while.
Great, thank you. So we have another question. So we've got a comment in from one of our participants, Jill, saying we haven't had any experience directly, but we're planning to isolate students and their close contacts, that is anyone they live with or have contact of within 2 meters for more than 15 minutes. Hopefully keeping students in small bubbles and using PPE will restrict any spread in the classroom. So fingers crossed on that one. We do have a question about what happens, have you thought about, or have you got protocols in place for when perhaps the students are interrupted because they do become unwell, or have you had to deal with students who haven't been able to attend because they are in a vulnerable group? So I don't know who'd like to take that one. Roy, great, thank you. And then
So on Friday this week, we've got a performance-based assessment coming up, and there was one student who was exposed to someone who is now isolating, and their trio is also isolating, so they're not able to take the exam this weekend. But we're awaiting test results. If they get their test results before Friday, they may take the exam. However, they haven't been in lab to practice. So we're planning on scheduling them during when we might schedule retakes for students who aren't successful the first time, which is 2 weeks from now. So we're kind of taking that on the fly, one by one, and making arrangements to try to make sure that we can successfully get them through, to make sure that they feel prepared to take the examination and not at a disadvantage.
Great, thank you. Nina, did you want to come in there?
Yeah, just to say that we are now planning for alternative dates for all exams, so that we have like one date for an exam, but we have to come up with dates so that in case someone is sick, either faculty or students, we have to have a plan for a retake. Yeah.
Thank you.
But
Oscar,
it's sorry, Emma, just to say that it's very difficult. What if students are away for a very long time, what do you do then? So I think that we don't have very clear rules for how to deal with that, and I hope someone has some good advice.
Thanks, Nina. Oscar, did you want to come in? No, all good. Okay, I thank you, Karen McCreesh from the University of Limerick, who's saying we're navigating our first positive case for a student at the present time. Lecturer and specific cohort of students are isolated for 10 days. 2 COVID tests are required and the classes are rescheduled. So there's a lot of having to be very agile, I think, with this. So we do have some questions around, are there any, so are people generating their own guidelines? Are there any sort of national guidelines? Have professional organizations produced the guidelines? Where are people getting their guidelines from? Or is it what a lot of us are doing is sharing best practice internationally? That's a question from Lily in the Philippines. So Roy, can I bring you in on that one? And maybe you might touch on the ACAPT guidelines, and then I'll draw in Nina and Oscar and see if anyone else has any answers to that question in the chats.
Sure. There are so many different sets of guidelines. So we have, from the national level, we have our Centers for Disease Control and Prevention. At the state level, every state in the United States has their own management plan, and that's been something that's been, you know, pretty difficult and contentious and political, believe it or not, although these days not too difficult to imagine. And then we have our ACAP guidelines from our national PT organization of physical therapy programs who are you know, related to coordinating high-level PT research. But our university has its own guidelines, and we have a lot of different health professions on campus and a lot of research that goes on. So we've had to kind of make them all work together for our program. So we've tried to hold ourselves to the higher standards of every single set of guidelines. We needed a plan in place that was, you know, protective enough that we could continue so that we didn't delay our students from graduating. So we figured that would make the most sense. We would be we would go to the extreme as much as possible to maintain safety, because that's paramount.
Great, thank you. Do either of the other speakers want to come in? Nina, what have you been using to inform your decisions in Norway?
Very similar to what Roy says. We have, like, you know, the Public Health Institute of Norway have guidelines, and then we have to follow those, but we have to make specific ones for our campuses and the whole university. So there are groups working with and updating this all the time. And we have also specific guidelines for our skills laboratories.
Great, thank you. Oscar, anything you'd like to add in relation to that?
Yes, the Ministry of Education in our country gave us the guidelines, but then the university has to do their own and present to the ministry for approval or not.
Great, thank you. So I will draw everyone's attention to the fact that we have lots of resources that are uploaded to the WCPT COVID-19 resource page, and some of the documents that have been referred to, particularly on the ACAP documents, are up there on that. Thank you to them. A couple of questions just around how people are managing sort of the mental health of both the students and the faculty, and sort of anxieties. So if I could get some insights in relation to that, that would be very helpful.
In the US, because we're part of a medical school, the American Association of Medical Colleges has released national guidelines related to that. So they recommend that all faculty get in touch with students individually. So every student is contacted by someone that they know, so that there's some familiarity there, so that we can check in first regarding basic needs. Are they safe? Do they have access to enough food? Because a lot of the students have had trouble getting even their student loan checks processed in a timely fashion. So there are some basic issues like that. But then, although we're not, you know, trained psychologists, psychiatrists, we've been trained how to screen, do some basic screening for mental health issues, to try to then get students in touch, provide them with resources, send them online links, or, you know, refer them on to someone if the student may need help.
Great, thank you. Oscar, I saw your hand up there.
Yes, well, we have the program, the psychology program. So they are working with all the students in our university, doing telehealth and supporting them.
Great, thank you. Nina, I know you had a lovely slide up, so please, anything that you'd like to add, that would be great.
Yeah, I think just talking to students is very important, and I'd love to see those national guidelines, Roy. Perhaps something that you can share on the in the Facebook group. That would be lovely. Sure, I can share that on there. Yeah. Yes, we don't have that, so that would be very good.
Super, thanks, Nina. So I'm mindful of the fact that we're coming up to the hour, but we can continue. So there are quite a few questions left. So for those of you who can stay, you're most welcome. For those of you who need to leave, we will be recording the session. For those of you who are asking about practice education, we do have a separate webinar on practice education. We have 3 more webinars coming up around this day each month for the next 3 months, and we will post information about those. Yes, this is being recorded for people who are asking that question. So two questions that are sort of something similar in terms of themes, which speaks to the issue of, I guess, the extent to which students have access to network and the bandwidth that they need for online teaching. So have you any experience where only asynchronous activities are accessible to students? If yes, what strategies or tactics would be helpful? And yes, I think there's two questions of similar, which is that a lot of the proposed strategies assume that each student has access to internet and computers, which may not be a reality for others. And maybe we need to think about a webinar that focuses a little bit more on that. But any tips or suggestions that you might have would be helpful. And World Physiotherapy team, let's put that one down as one that we might think about for a webinar in the future. Any thoughts? And anyone who would like to come in the chat with suggestions, please do.
We require all our students to have a device when they start. And in recent years, we've actually purchased the device and handed that to them. So they all have the same device, which makes it easier for the IT department to help manage any potential issues that come up. Now, we're very lucky in that we have a lot of resources. So I'm pretty well aware of that. But we have a requirement that we do synchronous learning even during this time. So we're still doing that. However, we can record some modules. We were posting some recorded modules in the past. So I've been recording things on the off chance that I need to go out, then I could at least have that as a backup.
Super. Great. Thanks, Roy. Oscar, did you have anything? One of the people who was asking the question, I think maybe from one of the countries in Latin America. So maybe could you speak to that?
Of course, we have many problems with connectivity and it's not cheap for everyone. So we have to guarantee the access to the class. So that's why we don't not only do a Zoom, we record everything and upload it to YouTube or to Vimeo or to a Google Drive and then link it to our campus. This is one option, of course. And in some cases, as I presented today, the university gave them a SIM card with 3 GB and this agreement with the companies for not consuming any data with the campus and the content linked to the campus. So this is a good option that all the universities, the national universities did. And the national universities are in general the ones that have a student with lower resources.
Great, thank you. So I think maybe we'll definitely we'll circle back around to that and see what we can do to set up a webinar that probably addresses more strategies around that, recognizing that not all of our students around the world will have the type of access that some have. So are there any online teaching strategies or laboratory teaching practices that you have implemented now during the pandemic that you would foresee carrying on even when we all get back to normal? Teaching practices that you feel you wouldn't go back to after this? So anyone, Lena, did you want to come in there?
Well, I can't say for sure what we will do afterwards, but I think that having cohorts we have like 6 to 7 students in each cohort, and they do not mix with the other students, and teachers are only in contact with 2 cohorts at a time. And I think, with all the infections that we might have, like a regular flu, it's a good thing that we don't give this to each other all the time. So I think maybe that's something we need to consider, that we don't mix that much. But at the same time, it's nice to have the opportunity to practice on different kind of people. So, well, I can't say for sure, Emma, how we will do afterwards.
That's completely fine. I don't know what any of us, I think it's very hard for us to say for sure what we'll do afterwards. We are going to be talking about virtual placements, I think, also. So, I think that's been a really interesting initiative in some parts of the world. That might be something that we will hold on to. I know I was talking to Karen McCreesh this morning about some of the great work that they're doing at the University of Limerick, and it's fantastic what they've done. And I think that might be something that the universities will hold on to. Oscar, anything that you've done recently that you think you'll hold on to?
I think we are going to migrate some of the materials that we teach usually in face-to-face to virtual. For example, bioinformatics or ethics, some of them are going to be just online for the future. So maybe we are going to increase our online teaching hours in a normal situation, of course. We have to, in our country, Argentina, we have to be 51% face-to-face and 49% could be online if you have everything according to the Ministry of Education to get a title with face-to-face learning, of course.
Great, thank you. Roy, anything that you're going to hang on to once life goes back to normal, whenever that happens?
Well, as far as our program is concerned, we're definitely going to include more telehealth education. I think in the past, prior to this, we had maybe 1 or 2 slides discussing telehealth. Now, I suspect there are going to be some labs practicing this. And a lot of our students who are around the country learned telehealth, in their clinics while they were, on their internships. So we may call on them to give us some ideas. But as far as my courses, like teaching orthopedics and manual therapy-based labs, I'm definitely going to be utilizing handheld phones for cameras, because if I'm showing a technique where I'm working on someone's cervical spine and I need to really get a camera in there, it's so much more useful than a camera on a tripod. I have always found that awkward to use a stationary camera, because if I were teaching someone live, I would be walking all around them and drawing their attention to certain things. So with a cohort of 65, they can't all gather around me anyway, so I don't want to return to that. They can actually get a much better view with the camera as long as I have very little lag time. And I think finally the technology is there that we can do that well.
Great, thank you. That's fantastic. Anything in terms of, so we had a question about how students are sort of managing with PPE and having to deal with that. Anyone got anything that they'd like to share in relation to that? Some are wearing more than others. How are people responding to that? How are people responding as faculty to that? Nina.
I just think that when we started using this now with the flare-up, I think faculty is very happy that we can use this. It feels safe, I think. Also the same for students, but then again, we don't have that many cases in Norway, so I guess even more important in other countries.
Thank you. Yeah, we had an interesting time the other day where we were teaching about nonverbal communication and how the fun that we've had with nonverbal communication, between masks and visors and all of that. So the students have had, we've had some very interesting conversations about how are we all going to work our way around that. So that's been very interesting from our perspective. A question for Nina, and I think for everyone actually, is this idea of, Nina, you mentioned that I think we've all had the experience of the students not wanting to switch their screens on, and how are you managing that? So how are people feeling from the sort of faculty perspective? Teaching a deck of cards is sometimes what it feels like, and that's about it, a list of names. How are people managing that? Anyone got some tips for how we might manage that?
I can just jump in and say that there was a moment I thought we should just force them to have the video on, when I just realized that, how does it feel to have the video on? That there is someone watching you all the time and that you get very conscious. And so we don't have any rules, but I think that it would be nice if someone has some good advice. I saw there was lots on the internet. So I think, it would be nice to have some good discussions on that in a Facebook group, perhaps.
Absolutely. That sounds like a great suggestion. Roy, Oscar, any suggestions?
So in the state of Maryland, we all have 50 different sets of laws in every state too. So in the state of Maryland, you cannot be recorded without your permission. And we record all our labs and any lectures. So if students want to ask a question, whether they're on camera or just a voice recording, they have to provide their permission. So we cannot require them to turn their cameras on, although I would love to, because yeah, it's very strange just sitting here in my room, just talking. So we definitely do not record, we do not require them to turn their cameras or microphones on. And even the labs are recorded as well. So when they're doing group participation, they're being recorded and we cannot legally require them to do so. So right across the state line in another state, then they can be recorded. So the university closest to us, the PT program closest to us actually can do that.
Great, thanks for that. That's really interesting. Oscar, any thoughts on this?
Yes, we use an option in Zoom that that enable us to record just the share screen and without the faces of our students. So this is the material that we upload. And for us, in one university, it is mandatory to have the camera on when we are on an exam.
Okay, great.
Just for the exam, not
yeah.
for the class.
Yeah, yeah, great, thank you. Suh-Fang, did you want to come in there with any insights from, you guys have been back almost full-time all the time in Taiwan. Well done, Taiwan, for its management of COVID-19.
Thank you. Yeah, I think we are such a great profession that we support each other, and I really enjoy that the solutions and responses from different countries that always bring us very useful information for planning and for conducting our education. Yeah,
great, thank you. In relation to that question about the students, it's funny, it's been different between our two cohorts. So our second year students just seemed to want to switch their cameras on. Maybe it's because it was their first time with us. But we did sort of reflect back to them that, if they hadn't got their cameras on, we weren't necessarily completely convinced that they were there, or they could be, scrolling on their phones in Facebook. And if they were, so we started to frame it around not just participation, but about engagement. So, we were sort of saying, well, we wouldn't be super keen if you were sitting scrolling through your phone in the classroom. So, we'd like you to be engaged with us online, and sort of kind of kept it light touch. But, sort of also explained that, every now and then we might want them to switch them on. And interestingly, I don't know whether it was just the different cohorts, but this particular group that I'm teaching at the moment, they had no problem putting the cameras on and were super engaged. So I don't know, is everyone just getting a little bit more used to it now? Are we sort of recognizing the fun of, well, you might be there on the screen, but you might be doing all sorts of other things, and even sort of admitting to that the odd time yourself, and sort of saying, well, if I do it, then how can I be sure that you're not going to do it? So we've had some fun with it, I think, as well, trying to sort of take a light touch approach to it, which I think it's been a bit of fun with the students. Are you really there, or is it your sister? So that's been a bit of fun. Now we've got a lot of questions, so I'm just going to scroll through them one more time. So there's quite a few about clinical teaching in the hospital setup, practice education. We will be coming to that on the 19th of October. There's a question about how do you know the students aren't cheating during their
Sorry, Emma, we cannot hear you.
Oh, yes. I thought it was you.
Oh.
Suh-Fang, Emma was asking what if students are cheating. How do we know if they're cheating on the exam? I can just say that from
okay. Yeah.
In Norway, they would have to have the camera on during practical exams or oral exams.
So you have each student have the camera on.
Yes, for that exam they have to, and then I think they also have to show that they, like, what do they have around them, like books or things. Yeah.
Good. And how about Roy?
So our computer system, we use a system called ExamSoft. So when they're logging in, it shuts down the rest of their computer so they can't access other information on their computer. I haven't run a, like when we run the written examinations, the computer-based examinations, that's actually proctored for me. So I'm not personally present during that examination. So I don't have to manage the administrative end of things with that. For the performance-based examinations, we've run 2 of those so far, so that's easy enough. But I believe what the proctors do is have them turn their camera on so they can see who's in their space. I don't believe there's a way that they can really manage that throughout the entire 3-hour examination, because someone could come in, and I don't believe there's a way that we have that managed.
What about Oscar?
Yeah, well, we discovered that examinations in the campus were much better than the oral presentations. So we reinforced the option of making the test by oral presentation, just face-to-face in group of 2. Of course, it takes a lot of time and a lot of work, but I think it's a better option because they are really cheating, or they are using the material that they have. Even if you have a system like Roy, they can use the print version of our books or our essay material. So this is a problem. But it's very interesting. Roy, could you please share with us the name of that system again?
ExamSoft is the software program that we use.
Oh, okay. Thank you very much.
Thank you.
It's an entire database system. So we store all our exam questions in a database, and we can move them around to folders, and then select a folder that has all the questions we want to use, and then we can utilize that for the exam. And then it has a Examplify, I think, is the system that's coordinated with that actually delivers the exams to them and randomizes the order of the questions and the sequence of each option and everything.
Perfect. Thank you.
Good. Thank you. I think Emma has come back, and she would like to. Is Emma there? Yeah. Okay. Great. Great.
But I'm happy for you to wrap up things if you want to.
Okay.
We're doing a tag team, so happy to hand over to you to bring us home if you want to do that.
Okay. So I think I would like to take this opportunity to thank all the speakers for their wonderful presentation and very innovative solutions that I think the information is very useful for all of you to plan for our return or conduct our education. And I also like to thank all the attendees for your participation and your bringing interesting questions. And this is a very interactive Q&A session that I enjoy very much. And please stay connected with the WCPT by visiting the website, joining the FB group, and coming back on October 19, the same time in the next webinars. And my final request for you is to fill out a poll about your satisfaction of today's learning activity. I'd like to thank you again with Emma's co-host of the session. Everyone stay very safe and very well. Thank you so much. See you very soon.
See you soon. Absolutely.
Yeah.
Thank you to everyone.
Bye.
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 Thank you very much.
Bye. Thank you.
Thank you.
Thanks, Nina. Thanks, Roy. Thanks, Oscar.